Good evening, Skechi Patel, microbiology class, lab 2117 lab. This is Project Cholera. So, what is a cholera? So, cholera is a acute diarrhea mostly occur by consuming the unhygienic food and water, unhygienic food like a street food or stale food. Cholera is a bacterial disease, and Vibrio cholerae is a bacteria which is responsible for the cholera. And cholera is a fatal disease too because World Health Organization give us a figure that 1.3 to 4 million peoples are affected with the cholera every year, and 21,000 to 143,000 peoples are die due to the cholera. Vibrio cholerae present in a patient's feces for 1 to 10 days, and cholera is a 1 to 10 days, and cholera is a curable disease. But we have to practice a good hygiene. We have to adapt a good hygiene practice to prevent the cholera, and start to drink boiled water and good food, like good quality food. So, what is the shape and structure of the cholera? So, cholera shape and structure over here. Okay, so cholera is a rod-shaped bacteria, but it is slightly bent from the center. So you can say comma-shaped bacteria. It's a gram-negative bacteria, and over here it has a flagella. Uh, its flagella will give that bacteria a movement. It will help in a movement. Villi will help to attach the attach with the surface. Nucleotide over here, DNA and RNA materials or genetic materials are stored. Has a capsule, cell membrane, cell wall. Okay, so it has a many serogroups, like 200 serogroups, but O1 and O139 are mainly occurs the outbreak. O1 is responsible for the current outbreak, and O139, which is responsible for the outbreak in Bangladesh in 1992, which is mainly affecting the coastal areas of Bangladesh and India. So, how is cholera acquired? So, cholera is it could be endemic and epidemic. So, epidemic it means happen in a one particular region, and endemic it's like happen multiple times in a one particular region. So, endemic outbreak countries. Has a cholera season is mainly rainy season because cholera is a waterborne disease and is mainly occurs in a wetland or coastal areas. So cholera is a very common in countries which has a poor sanitization or poor hygiene practice like the South Asian countries, Africa, South America, and yeah, you can say in Sri Lanka or Southwest countries, Southwest Asia. So cholera started in the 19th century in the Ganges Delta, western part of the India and Bangladesh. So during in the 19th century, Bangladesh was also part of the India. So you can say in the western part of the India. In the 1961, it will reach in the South Asian countries, and in 1971, it covered the African countries, and 1991, it uh, it will affect Latin American countries. Cholera killed the millions of people in the world every year, as we discussed previously. So it's before Corona outbreak happened, cholera was the sixth dangerous pandemic disease. But right now, it is the seventh dangerous pandemic disease, and as World Health Organization given us the figure, according to them, that figure will increase every year. The life cycle of the Vibrio cholerae bacteria. So Vibrio cholerae bacteria are naturally present in the water, but over here they consume organic pollutant like human waste and animal waste, and it will grow over here and contaminate that water, and that water is consumed by the human or the animals, and over here it in a human it reach in a human digestive system, and the pathogenesis happen like it reach in a stomach. Stomach is acidic, so some bacteria in a die in acidic media because Vibrio cholerae can survive in alkaline media. It's like alkaline media more, and then it reach in a human small intestine. Over here, it make colonies, and the rest of will take exit from the human feces, and in human feces it can stay for like 1 day to 10 days. The incubation period of the Vibrio cholerae bacteria is like 2 hours to 5 days. And here is a number the World Health Organization provided. Yes, and I got this image from the one local African news channel, but they just get it image from the World Health Organization. Yeah. Okay. So here is the few points which are described in the previous figure, that is found in a wetland and coastal area, and it will consume the organic pollutant like a human waste. Then they contaminate the water. Okay, sea life play the big role in a Vibrio cholerae bacteria, because like it's a waterborne bacteria. So they also consume the sea life waste, whatever their organic waste consumed by the Vibrio cholerae bacteria, and they grow. So that's how sea life play main role. I mean that role in a Vibrio cholerae life cycle. Yeah, and that life cycle get repeat. Okay, the pathogenesis or mechanism of the action of the Vibrio cholerae bacteria. So as we discussed previously, that it transmitted with the fecal oral route. It's not transmitted by the direct contact. If you consume something unhygienic or something already contaminated with the bacteria, then you might be get infected with the Vibrio cholerae bacteria. Uh, it like alkaline media, so they cannot survive in a human stomach, but the survived bacteria, they just reach in a human small intestine and make a colonies over here. And in a small intestine, that bacteria secrete enterotoxin. And here the bacteria secrete the enterotoxin. That enterotoxin uh, bi- make a bond, combine with the epithelial the epithelial cell and cell of the small intestine, and secrete the enzyme. That enzyme help to rise the level of ACMP. CAMP is a cyclic adenosine monosaccharide monophosphate, and that will increase the secretion of the electrolyte and of water in a intestinal lumen. So that is the main reason for the diarrhea. Sign and symptoms. So sign and symptoms of cholera is appear in 12 hours to the 5 days. um, Human, so like in a adult or children, anybody can get affected with the cholera. And cholera, if cholera left untreated or delayed treatment, it could be prove fatal. Mm, Diarrhea and vomiting are the main sign and symptoms of the cholera. Due to diarrhea, it leads to a dehydration, uh, obviously abdominal cramp, dry mouth again because of the dehydration, low urine, low blood pressure again because most of the electrolytes and water we lost in a diarrhea, so blood pressure get low. Okay, so how we can diagnose the cholera? So the only way of diagnosis of the cholera is a stool examination and emesis examination. Okay, treatment of the cholera. So for the mild dehydration, doctor are prescribe oral rehydration solution like ORS. In ORS for severe dehydration, doctor will prescribe IV fluids and antibiotic treatment. And in a rare cases, like mostly in a pediatric cases, doctor will prescribe zinc-based supplement to bring that electrolyte in a balance. Okay, precautions of the cholera. So we have to take a precautions, as like we will just avoid street food and packaged food, and yeah, we have to practice to uh, drink boiled water, and we boil water for drinking and cooking both. Avoid uncooked meat and seafood. Wash vegetables, fruit, whatever raw materials, whatever raw food we are uh, consuming, we have to make sure that we wash before we consume. um, Wash your hand after using toilet. Yes, that's necessary. Wash your hand after using toilet, or use a hand sanitizer. That will be That's how we can prevent cholera. Thank you.